The following program has been furnished and paid for by Ask the Expert Show. KSEV is not responsible for its content or the products or services offered. Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host.
And we do welcome you to another edition of Ask the Experts here on AM 700 KSEV. Proud to be the voice of Texas. I'm Jack Gonzalez. And yes, we do talk to people involved in different parts of businesses that may be of importance to you. And this time, it's home health and hospice care. And joining us to talk about just that is Felix Scannaball with Avatar Home Health and Hospice. Hey, thank you for joining us for another edition of Ask the Experts here, Felix.
Thank you for being here and helping me, Jack. Oh. This is, I mean, like, you know, we've been doing this now for almost 2 years, and I don't mean the agency. We started the agency back in 2006, but we've been doing the radio show now going on 2 years. I think, like, in April, it's going to be our second anniversary.
In honor of my birthday. I really appreciate that.
Oh, there you go.
So we got two celebrations going on there.
Okay, so we'll bring you a cake.
Thank you very much.
But you know, like, again, we've been doing this since 2006. We do home health, we do hospice, we do provider services or caretaker services. So almost any services you might need at your home, you can call me at 281-703-8050. And I'll be more than happy to talk to you and just give you information, even if you don't need it today. And Jack, one of the things that I tell people is, I tell people not to do what I do. Because, like, for instance, you know, I'm supposed to be planning for my retirement or all of that stuff, right? So I leave it for tomorrow. So this thing about what is going to happen to me when I retire and say, no, I have nobody to take care of me. Where am I going to live? Am I going to be able to stay at home by myself and take care of myself? What happens the day I'm not able to take care of myself? Who's going to take care of me? Where am I going to live? So all of those questions need to be asked now and not to wait until it happens. So that's our emphasis, is for people to plan, have some contacts, even if you only have my phone number and you call me once and now you already, you know, you spoke to me, I tell you a little bit about our services. The day that you or somebody you know or a loved one needs the services, you got the number, you know that I'm going to answer you when you call me, and now you have some basic information where you can be helped.
And that is something that's very important to keep in mind, because we plan for other parts of our lives in the future, retirement plans and all that other stuff. You were talking about retirement earlier. Mm-hmm. And if you plan for this in advance, you know, say you receive a medical condition, or you said you've had patients that the doctors told them, you know, you're going to need this health care kind of immediate. Well, you're not rushing around at the last minute making a forced decision. If you plan this in ahead, in case for you or a loved one reaches that age, you got plenty of time to work things out and check things out, as a matter of fact.
As a matter of fact, this week, we had a good case, a good example of that. We have a lady, a patient in hospice. Her caretaker is her husband, who's in his 80s, healthy, but in his 80s. Well, I don't know about healthy, but, you know, he's in his 80s, taking care of her. They don't have any other relatives except their son that lives, I think he lives in Dallas, right? So the other day, something happened to the husband, who is the caretaker. They call 911. Here comes the ambulance. They take him to the hospital. Now, 10 o'clock at night or so, I get a phone call from the son in Dallas. And says, Mr. Felix, I'm such and such son, and this is what happened. How can you help us? So now, 10 o'clock at night, we have a patient that is bedbound. She cannot even get out of bed on her own. She's all alone at home. The husband is in the hospital. The son is in Dallas. So now what happens? Exactly. Mm-hmm. Thank God that she was an Avatar patient, and we were able to get somebody there and stay with her overnight. And then we got there somebody in the morning, and in the morning we were able to place her in an assisted living facility until her husband got back on his feet. So imagine if that would have happened to someone that had no services, that didn't know any better.
That would have been tough.
Exactly. So what happens? The man is taken in an ambulance to the hospital. The patient who is sick stays on bedbound, stays at home all alone. They got nobody to help him.
And to look after them. I mean, what if something happens to them?
No, I mean, she needs a diaper change. She needs to be fed. She needs to be washed. She needs everything.
Which is all stuff that you guys take care of.
We do all of that. So, and that's what I tell people. And it happens. I mean, our nurses have gotten to a patient home, and let's say they call them to make the appointment and they don't answer, and we go anyways. What happens? You find the patient on the floor. Why they didn't answer? They leave all alone. They couldn't get the phone. I mean, they fell down on the way to the phone or whatever. And now the patient's laying on the floor. And we have found patients on the floor that they've been laying on the floor for, 16, 18 hours.
Oh, my goodness.
Yeah, because they leave all alone. So if you have a loved one, a family member, a neighbor, or even yourself, if you know of an elderly person that's living on their own, somebody who's ill, that have some health issues, if they're living on their own, please call me at 281-703-8050, and we can at least get some information to you and to them, and that way they'll know what to do in case of an emergency like this.
Or if they're married, as you just said in your story, and the other person is, of course, up there in age as well, too. I mean, they might still need care regarding an example you just provided. And I like in that story, Felix, in that you said they called you at 10 o'clock at night.
Yes.
Because, that's very good to know that if something happens late at night, which it could happen, you never know what's going to happen,
exactly.
Overnight or something like that. You guys are there. In fact, your phone is always on you as you tell people to call you, and that is Felix's personal phone, ladies and gentlemen. So when you're not just talking to a machine or someone that's going to give him the message, you're going to talk to Felix himself.
Right. Yeah. That's what we do. We do our best to give excellent services, and it shows. It shows because our reputation after 14 years is our nurses are excellent. I mean, of course, I'm blowing my own horn here, but this is something that people attest to it. I mean, we have people on the radio show saying you don't have nurses, you have angels. I mean, that's the thing that sticks to my mind.
And we've read those testimonials for you before as well. That's exactly how they refer to them, as a matter of fact.
Exactly. So we do a lot of good for patients, and we try our best, even though sometimes, it's hard to help people. They don't have the right insurance. They live way out of our area, even though we cover all of Harris and Montgomery County.
Right.
And even outside of Harris and Montgomery County, we go to, for instance, in Fort Bend, we go to Sugar Land. Now we're hoping to expand to Richmond and Rosenberg.
Oh, right.
We go in Liberty County. We go all the way to Cleveland. We go all the way up to Willis. So we do the Woodlands, Conroe, Willis. We go to Magnolia, Shenandoah, the Woodlands, Tomball, Humboldt. So we go almost any place in Harris and Montgomery County and a little bit outside of it. So, by the way, that brings me to the idea, Jack, that we need nurses. Please call me.
Pass along, because we said that before.
Oh,
so
my God.
That information, let people know.
Yes. Because of the services that we provide, and now, a lot of things have changed in home health because Medicare changed the rulings, and a lot of agencies are finding very hard to take care of their patients. So what's happened is that since the middle of last year, our census has grown, I think, by 30 or 40%.
Wow.
So we are in real need of nurses that are compassionate, nurses that do care for the patients. You can enjoy the flexibility of the home health schedule, which a lot of nurses are in home health and hospice because they have flexibility. Like if they have kids in school and stuff like that, they can arrange their schedule around their children's schedule. So you can, if you want to make a lot of money, you can call me and you can see, we'll give you a lot of visits. It all depends on how much you want to work. We have a nurse that's semi-retired, and she talked to me last Thursday, and she told me, Felix, I want to stay with about 20 visits a week. So she'll do 20 visits a week. We have other nurses that we have to tell them, no, you have too many visits. You know, so with us, you have the opportunity to basically tailor your working hours to your needs. So please call me at 281-703-8050. If you're a registered nurse or an LVN, please call me.
They'll put you to work, that's for sure.
Yes, for sure.
And I want to go back to something you mentioned earlier as far as helping people, as far as finding out about their payment procedures, if they have questions in advance about, hey, how do I go about, you know, because you'll go through all their personal information and find out that information from them, what they're qualified to have and what they're not qualified. And if you can't help them, you've told them you've been able to direct them to other those sources that might be able to help them.
Oh, for sure. Like, actually, one of the things that we need to clarify, because a lot of people don't call me because they might think I'm selling something. They might think I'm going to charge them something. They might think that our services cost. And actually, 98% of the services we provide are either paid by Medicare, Medicaid, or your insurance company. So do not fear. Call me. If we take care of you or take care of one of your loved ones, there's no out-of-pocket expenses, unless you want like a private caretaker or something like that. That's different. But as far as your nursing, your home health aides, your therapist, even a speech therapist, your social worker, if you're in hospice, your chaplain, the visiting doctors, all of that is included. There's no limit, there's no copayment, there's no deductible. So please call me at 281-703-8050. Let's plan today, so when it happens, because we all know that something's going to happen eventually. When it happens, you'll be prepared.
And let's pass along once again the website as well, avatarhomehealth.net. That's AVATAR homehealth.net. Well, we're at the halftime break of our show, so we're going to step away for just a few minutes, and when we do, we're going to talk more about the services Felix provides with Avatar Home Health Agency. We're going to talk a little bit, of course, about his certifications. You've got a whole list of them here, Felix. Medicare certified, Medicaid certified, licensed and insured, and of course, as you said, regarding the nurses, we want to let them know as well, too, bilingual staff and nurses as well, so we definitely want to pass that along as well to let you know. I'm Jack Gonzalez, and you're listening to Ask the Experts here on AM 700 KSEV, the voice of Texas. We'll be right back.
Do you or anyone you know need help with your daily activities, grocery shopping, bathing, cleaning, cooking? If you do, Avatar Home Health and Hospice can help you. Avatar Home Health can also help if you need nursing services and or therapy services in the convenience of your home. If you live in Harris or Montgomery County, in most cases, they can start services within 24 hours of your calling them. Avatar Home Health and Hospice was established in 2006. Avatar Home Health and Hospice is not only Medicare and Medicaid certified and licensed and insured, but is one of the few agencies that has received the Gold Seal from the Joint Commission. This accreditation has only been granted to less than 9% of the agencies in Texas. At this time, Avatar Home Health and Hospice takes care of over 340 patients. Whether it's home health, hospice, or caretaker services, one of their 220 professionals will be assigned to help you. Avatar Home Health accepts Medicare, Medicaid, United Healthcare, Aetna, Molina, Humana, PPO, and other insurance companies. They also accept private pay patients. They can also help you find what benefits you qualify for. Most of their services are paid by Medicare, Medicaid, or your insurance company most of the time, without any out-of-pocket expense to you. Call Avatar Home Health and Hospice at 281-703-8050. That's 281-703-8050. Or email them at info@avatarhomehealth.com.
And we do welcome you back to Ask the Experts here on AM 700 KSEV, the voice of Texas. I'm Jack Gonzalez, and if you're just tuning in, we're talking about home health and hospice and palliative care for a loved one. that you may have in the family, or maybe you just want to plan ahead. Felix Cannibal with Avatar Home Health joins us to talk about that. I mentioned palliative care, Felix, and there are some of your patients that require that. So can you go a little detail what that is all about for some of our listeners who may not be familiar with it?
Sure. No, it actually is something, even though we've been doing it for years on the different names, it's something now is like a specialty. It has become a specialty. And that is, we're talking about palliative care, which is like the care of chronic illnesses. So before, when you're in home health, obviously, and you have a chronic disease or illness, the home health agency is going to take care of it, and your doctor is going to treat it. The problem with that is that in many instances, those illnesses are painful, or the patient has a hard time ambulating. So now imagine that you can hardly walk and you have to go to your doctor at least once a month. And that you're going to be taking pain medication. So now the doctor's looking at all the problems that we're having out there with the pain medications, people stealing drugs and people, overdosing with drugs and what have you. So the doctors are a little bit concerned with that. As a matter of fact, some doctors will not prescribe a controlled substance.
Really?
So if you need hydrocodone or something like that, they're going to send you to a pain specialist, or they're going to send you to a specialist. Because of the liability that, by accident they can lose their license, So but I don't, not going into that. But there are patients that have this special need, and it makes it as time goes by, it's more and more difficult to them to get to the doctor. Then somebody has to supervise that if you're taking pain medication, that you're taking the right dosage. You don't want to overdose. You don't want to be underdosed either, because if you don't take enough, then you're going to be in pain. So the way that palliative care works is that a doctor is going to visit you at your home. You're going to go into palliative care. That doesn't mean that you have to stop your home health services if you have home health services. That doesn't mean that you're not going to go to your specialist or your PCP. That means that you're going to have a doctor that's going to visit you at home and control or supervise your medication intake, your pain levels, and how comfortable you are and what have you. And then you're going to have a nurse practitioner come to your home every other week or once a month, depending on your needs. And they're going to monitor that, and they're going to report that to the doctor, so they make sure that you're following your plan of care, the way you're supposed to. Because people talk about cancer, they talk about heart attacks or heart disease, they talk about all of these different illnesses that actually kill us.
Sure.
And the number one killer of senior citizens in the United States is actually over-medication or under-medication.
Right.
Or taking the wrong medication.
Because of their state of mind, unfortunately, getting a little lost a little bit.
Yeah, imagine,
right?
We have patients that are taking 20, 30 different pills a day at different times of the day. So, I couldn't keep up with it.
Yeah.
Actually, I got a call last week, and the doctor gave me some antibiotics, and I was supposed to take one before breakfast, one after lunch. But
right.
I messed up the whole thing because I wasn't paying attention.
Right.
So imagine that's with one pill. Imagine if people taking 20, 25, 30 pills a day.
And it could be very dangerous, as you said, if they take more. In fact, you said earlier before that your nurses have gone to a patient's home and they found some of the medication missing, and then you come to realize they made a mistake and actually took too much, which is why it's very important to have a service like yours. You can go in and check on these patients to make sure not that they're all right, but they're not hurting themselves, but like you said, not taking enough or too much medication. That would be very bad.
Yeah, exactly. So this is what palliative care does. Now, by having somebody there, again, if you're a home health patient, you can still get the nurse will visit you. One service doesn't interfere with the other one. As a matter of fact, they complement each other really good. Because you're basically having like a doctor's visit at least once a month. And Medicare, we pay for that, where if you go to the doctor's office and you go every month just to have a checkup, then the doctor might not get paid from Medicare. And I don't want to get into all those technicalities, but that's why many doctors say, well, come and see me in 60 days or 90 days or 120 days, because the more often they see you without a good reason, they might get penalized by Medicare or by the insurance company that you have. So with palliative care, let's say that the patient gets better, and let's say he's having palliative care and home health, they get better, the home health can stay out. The palliative care will be there for the duration, because we all know that is a chronic disease. So that's not going to get any better. It might get controlled.
Right.
I mean, in some cases, I don't want to say never it's going to get any better, but in most cases, it's going to be there for the duration, and then they can control the pain and the progress, and they can monitor it better. And then if the patient gets to the point where, it's coming to the end, I mean, the patient is going to be, it's going to pass within the next 6 months or so, then that same palliative care can call a hospice agency like Avatar Home Health and Hospice, and we can go there and we can do the hospice services. Again, the palliative care can stay. No, I'm sorry. Let me rephrase that. Once a patient goes into palliative care, then there's no need. I'm sorry. Once a patient goes into hospice, the patient doesn't need palliative care anymore, because hospice takes over the palliative care.
I see.
Because we have the visiting doctors, and then you have. So we give them palliative care plus. That is basically what hospice is.
And your funding for that, of course, you'll check on that as well too, to make sure it's all covered properly and everything. Because
exactly.
I'm sure people will think, okay, now I got to go to different care. How is that going to cost me now? And of course, you'll keep them updated, or you'll tell them up front, hey, this is what's going to happen as far as that funding.
Well, actually, if a patient if you're a Medicare patient, most of the times you're not going to pay for our services, whether those services are home health, hospice, palliative care. You're not going to pay for them. The only case where you might pay something, that's something optional. Again, if you do not have Medicaid and you need somebody to spend 4 or 5 hours on a Sunday with you, you want a caretaker there for some reason, and then that would be pay out of pocket.
I see. Now, you mentioned earlier about the doctors and everything. So obviously when doctors visits and everything, now if a patient has a doctor already and they get involved with Avatar Home Health, can they still keep their same doctor, or how does that process work?
Of course. Yeah, we actually depend on their doctor to tell us what to do. I mean, we know basically we have an idea of what the plan of care is going to be, but the patients are actually referred to us by doctors. So the doctors recognize the need for the services. They send us a referral, let's say like a prescription, right?
Sure.
So then our nurse goes out there and does an assessment, and the registered nurse that have been very well trained to do this will come up with a plan of care. That plan of care is submitted to the patient's doctor, and the patient's doctor has to approve it or amend it. If he wants to change something, he can change it, obviously. He's the doctor, he's in charge. So whatever we do, we're going to do in coordination with the patient's doctor. So yes, you work with your own doctor. Now there's some cases, for instance, when the patient starts, declining, they become bed-bound. They cannot go to the doctor. The doctor doesn't make home visits. And then if the patient requests it, and we know that and the patient needs it, we call their doctor and say, okay, the patient needs a home visit. And the doctor says, well, we don't make home visits. And then we're going to tell the doctor, okay, for the time being, until the patient can make it to your office, we're going to send them a doctor to visit them at home. And so that doctor will take care of the patient until that patient can go back to the regular doctor. So there's a lot of ways that we help patients. The most important thing is for the patient not to go without the services.
Sure.
And you see that. But many times we send an order to the doctor. Like say a relative calls us, Jack, and say, "Oh, my mom needs services, and I know you're taking care of our neighbor, and they love your nurses, and they love your company. Can you do the same for my mom?" I say, "Well, her doctor has to approve it, right?" So we send an order to a doctor. And the doctor says, "Well, I cannot sign this order because I haven't seen this patient for 4 months." So how can somebody of age with illnesses and so on stay healthy and live at least have some kind of quality of life if they're not being seen by the doctor? Right. Nobody goes there.
Especially at that age, and they have health issues in the first place. Felix, it's hard to believe we're almost done with the show. So before we do sign off, though, we do want to go ahead and once again, a lot of good information there. Now you kind of, I'm sure, tweaked the interest of some of our listeners. So let's pass along, once again, your contact information and let people know how they can contact you on the phone there.
Yes.
And once again, this is Felix's own personal phone. You can call him anytime, as he mentioned earlier in our show. Had a caller call him late at night. So go ahead and pass along that information.
Please call me at 281-703-8050. That is 281-703-8050. And our website is avatarhomehealth.com. And there's a lot of information, all the radio shows, you have access to the radio shows on the website. And there's a lot of information, so please visit us.
And once again, that's hospice care they provide, that's home health care they provide, palliative care they provide, so they cover just about all the boundaries. But nonetheless, if you still have some questions or maybe you'd like to hear some more information, please do call Felix and let him know that you're interested, and he'll be happy. And you're no obligations. You're not going to twist your arm and say, "Hey, now you have to be part of us." If you just need some information and hopefully you'd like to do business with him, Felix will be happy to help you out and get any other information that you might need across. Felix, we thank you once again for joining us for another edition of Ask the Experts here on KSEV.
No, thank you, and thank you to all the listeners for giving us their time.
And we certainly do appreciate it because, as we said before, that is a lot of very, very important information that our listeners need to know. So once again, we do want to thank you for joining us on this Sunday. I'm Jack Gonzalez, and you have been listening to Ask the Experts here on AM 700 KSEV, the voice of Texas.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.